This is Appendix 3 at the clinic, beginning on page 289. This appendix contains examples of medical terms in their proper clinical context. It may contain terms you have not yet encountered, but all are listed in the mini dictionary. So the first section is going to be what's your diagnosis for chapter 1, 2, 3, and 4. And then we have case reports regarding cardiology, gastroenterology, gynecology, endocrinology, nephrology, neurology, radiology, oncology, orthopedics, and also urology. So again, our first section, what's your diagnosis? The following patient scenarios use terms and concepts found in the first 4 chapters of this textbook. After reading the clinical stories, choose the correct diagnosis. So Chapter 1, a 7-year-old male presents with fever, sore throat, runny nose, and persistent fatigue. He's the feeling of being tired all the time. Physical examination reveals multiple bruises or contusions of his lower extremities and arms, and erythematous or red pharynx, throat, with white plaques on the tonsils, and pale gums, lips, and nail beds. Complete blood count was performed. Increasing fever prompted immediate admission to the children's ward of the hospital. During the course of admission, the patient's pharyngitis was monitored and subsided. Tonsillitis was ruled out. Fatigue and contusions on his arms and legs were noted and addressed with the parents while taking his social history. A lab hematologist reviewed the high white blood cell count and a white blood cell differential. Percentages of the various types of these cells shows immature cells. A bone marrow biopsy confirms the diagnosis of white blood cell malignancy. What would be the principal diagnosis? So we have the options of hyperthyroidism, leukemia, fever, contusions, or leukocytes. So with all symptoms presented and his white blood cell count malignancy, this is going to be a diagnosis of leukemia. All right, next, Chapter 2. A 67-year-old male with a 2-pack-a-day history of smoking and hypertension, high blood pressure, presents to the emergency department complaining of hematitis. This is coughing up blood. Fatigue, back pain on his right side, polyuria, which is frequent need to urinate, and headaches. The elevated blood pressure, hematitis, and headaches require observations in the ED. The patient is admitted and diabetes is ruled out as a cause of polyuria. A chest x-ray for hematitis reveals a right lower lobe mass. Needle biopsy confirms malignancy. The patient agrees to have a lobectomy performed. He is counseled on his tobacco use during recovery, and he agrees to begin therapy for tobacco cessation. What is the principal diagnosis? Lung cancer, hematitis, polyuria, diabetes, or hypertension. So with all symptoms, he has the hematitis of coughing up blood. They performed the needle biopsy of malignancy. This is going to be a diagnosis of A, lung cancer. Chapter 3, a 45-year-old obese female presents complaining of menorrhagia or heavy periods with cramping pelvic pain, dizziness when standing, and rapid heart rate. Manual physical examination demonstrates multiple enlarged masses in her uterus. Blood workup reveals low red blood cells and low hematocrit percentage of RBCs in a volume of blood, normal white blood cells and platelets, and slightly elevated blood sugar level. Ultrasound of the abdomen and pelvic show masses or leiomyomas of the uterine wall. The patient is admitted to the hospital with recommendation for a hysterectomy. During the course of admission, she speaks to the resident dietitian about a compulsive eating disorder and agrees to undergo therapy at the hospital's weight loss clinic. What is the principal diagnosis? So the reason for admission, which is going to be your principal diagnosis, for this we have the option of pelvic pain, obesity, anemia, menorrhagia, and fibroids. So the reason for admission for this particular scenario would be the E, fibroids. Chapter 4, a 22-year-old sexually active female presents to the ED with history of temperature of 104 degrees Fahrenheit for 2 days, vomiting, diarrhea, and a red spotty rash over her chest and abdomen. She reports that she remembered not removing a tampon from her last menstrual cycle until a week after she had stopped menstruating. Other complaints include dysmenorrhea and dysuria. Physical examination does not reveal an acute abdomen, sudden severe abdominal pain, or any right lower quadrant tenderness. Blood test is negative for HCG, which is human chorionic gonadotropin or pregnancy test. CBC reveals elevated white blood cell count. Blood cultures are positive for staphylococci. The patient's fever and dehydration do not subside with initial emergency care, and she is subsequently admitted to the hospital. She is seen by a physician from infectious disease who confirms that the retained tampon was the cause of her infection. Her condition improves with IV fluids and antibodies. What is the principal diagnosis? Dehydration, fever, toxic shock syndrome, rash, or nausea and vomiting. So the principal diagnosis for this particular scenario would be C, toxic shock syndrome from the tampon that was left in for a very long time. Okay, our next section are going to be case reports. These are samples of clinical reports from various medical specialties. Our first case, number 1, is cardiology. Mr. Rose was admitted to the cardiac care unit with angina and a history of hypertension. A coronary angiogram showed spasm of the right coronary artery, causing acute myocardial ischemia. An electrocardiogram showed ventricular arrhythmias as well. Nitroglycerin was administered, and within minutes, the angiogram showed reversal of the spasm. The ECG recorded reversal of the life-threatening arrhythmias as well. To prevent further ischemia and myocardial infarction, Mr. Rose's treatment will include antiarrhythmic, diuretic, and anticoagulant drugs. In the future, he may need an additional procedure to place a stent in his coronary artery to keep it open. Our terminology for this particular case, we have acute myocardial ischemia, sudden decrease in blood flow to the heart muscle, angina, sharp pain in the chest resulting from a decrease in blood supply to heart muscle, also called angina pectoris. Antiarrhythmic is pertaining to a drug that works against or prevents abnormal heartbeats. Anticoagulant, a drug that prevents clotting. This is given when there is danger of clot formation in blood vessels, as may happen after a heart attack. A coronary angiogram, an X-ray record of blood vessels surrounding the heart. Diuretic, a drug that causes kidneys to allow more fluid to leave the body. Remove fluid from the blood and are used to treat hypertension. And hypertension is high blood pressure. A myocardial infarction is death of tissue in heart muscle, also known as a heart attack or MI. Nitroglycerin, drug that relaxes muscle and opens blood vessels. Spasm is an involuntary sudden muscle contraction. A stent, a tube inserted into an artery, blood vessel, or duct to keep it open. And ventricular arrhythmias, abnormal heart rhythm originating in the lower chambers of the heart. Next is case number 2 for gastroenterology. Mr. Pepper suffers from dyspepsia, acid reflux, and sharp abdominal pain. A recent episode of hematemesis has left him very weak and anemic. Gastroscopy and an upper GI series with barium revealed the presence of a large peptic ulcer. Figure 2 is a photograph of a peptic ulcer located in the stomach. Mr. Pepper will be admitted to the hospital and treated with medication to reduce gastric acid output and with antibiotics to control a bacterium known to cause ulcers. If his condition does not improve, he may be scheduled for a partial gastrectomy. Our terminology for this case, we have abdominal. This means pertaining to the abdomen. Anemic, pertaining to anemia, which is a deficiency of hemoglobin and or a number of red blood cells. Barium is a substance used as a radiopaque. This means X-rays cannot pass through it. Contrast medium for X-ray examination of the digestive tract. Dyspepsia is painful digestion. Gastrectomy, excision or removal of the stomach. Gastroscopy, visual examination of the stomach. Hematemesis is vomiting of blood. Peptic ulcer, an open sore that develops in the lining of the stomach or the first part of the small intestine. And then upper GI series, this is when barium is swallowed and X-ray images are taken of the esophagus, stomach, and small intestine. Case 3 is gynecology. Ms. Sessions has had dysmenorrhea and menorrhagia for several months. She is also anemic. Because of the presence of multiple fibroids as seen on a pelvic ultrasound or sonogram, a hysterectomy was recommended. After it was removed, the uterus was opened to reveal multiple fibroids or leiomyomas bulging into the uterine cavity and displaying a firm white appearance. Our terminology for case 3, we have anemic, pertaining to anemia, deficiency of hemoglobin and or a number of red blood cells, dysmenorrhea, painful menstrual flow, fibroid, benign growths of muscle tissue in the uterus, hysterectomy, excision of the uterus either through the abdominal wall or through the vagina, leiomyomas, benign tumor derived from smooth muscle, most often of the uterus, menorrhagia, excessive bleeding from the uterus during the time of menstruation, pelvic ultrasound, recording of sound waves as they impact organs in the region of the hip, and sonogram, record of sound waves after they bounce off organs in the body, an ultrasound or echogram. Case number 4 is endocrinology. A 22-year-old individual known to have type 1 diabetes mellitus was brought to the emergency department after being found collapsed at home. The patient had experienced 3 days of extreme weakness, polyuria, and polydipsia. It was discovered that a few days before admission, she had discontinued use of her external insulin pump. Our terminology for case 4, we have insulin pump. This is a portable battery-powered device that delivers insulin through the abdominal wall in measured amounts. Polydipsia, excessive thirst. Polyuria, excessive urination. And type 1 diabetes mellitus, disorder marked by deficient insulin in the blood, which causes sugar to remain in the blood rather than enter cells, marked by lack of insulin, and patients need injections of insulin. Case 5 is nephrology. A 52-year-old female with chronic renal failure secondary to long-standing hypertension has been maintained on hemodialysis for the past 18 months. An arteriovenous fistula was created surgically to provide long-term vascular access for hemodialysis. For the past 3 weeks during the dialysis sessions, she has become moderately hypotensive with symptoms of dizziness. Consequently, we have decided to withhold her antihypertensive medications before dialysis. Our terminology for case 5, we have antihypertensive. This is a drug that reduces high blood pressure. Arteriovenous fistula, a new communication between an artery and a vein. It can be created surgically to provide access for hemodialysis. Chronic is lasting a long time. Hemodialysis, use of a kidney machine to filter blood to remove waste materials such as urea. Blood leaves the body, enters the machine, and is carried back to the body through a catheter. Hypotensive, pertaining to low blood pressure or to a person with abnormally low blood pressure. Renal failure, condition in which the kidneys no longer function. Next for case 6 is neurology. Ms. Kendrick is admitted with severe throbbing unilateral frontal cephalgia that has lasted for 2 days. Light makes her cringe, and she has nausea. Before the onset of these symptoms, she saw zigzag lines for about 20 minutes and a scotoma. Diagnosis is acute migraine with aura. A vasoconstrictor is prescribed, and Ms. Kendrick's condition is improving. Migraine headaches are thought to be caused by sudden dilation of blood vessels. Our terms for neurology, we have acute. This is sharp, sudden, and intense for a short period of time. Aura is a strange sensation coming before more definite symptoms of illness. Often precedes a migraine headache or an epileptic seizure, warning the patient that an attack is beginning. Cephalgia is headache. Dilation is widening. Frontal, pertaining to the front or anterior. Migraine, attack of headache, usually on one side of the head, caused by changes in blood vessel size and accompanied by nausea, vomiting, and sensitivity to light. Nausea is unpleasant sensation in the upper abdomen, often leading to vomiting. Scotoma, a defect in vision in a defined area or blind spot. Unilateral, pertaining to one side. And vasoconstrictor, a drug that narrows blood vessels, especially small arteries. Next is case 7, which is radiology. Evaluation of David Green's postero-anterior chest X-ray film shows an ill-defined mass near the right hilum of the right lung. The lateral view also shows the mass, and its shaggy outline is very suggestive of carcinoma. Further evaluation by CT scan clearly shows the mass in relation to the mediastinal structures, such as the pulmonary artery and aorta. Our terms, we have aorta. This is the largest artery that leads from the lower left chamber of the heart to arteries all over the body. Carcinoma is a cancerous tumor. These form from epithelial cells that line the internal organs and cover the outside of the body. CT scan, computed tomography study. Series of X-ray images showing organs in cross-section. Hilum is depression at the part of an organ where blood vessels and nerves enter. Lateral means pertaining to the side. Mediastinal is pertaining to the mediastinum, the space between the lungs. Postero-anterior, pertaining to the direction from back to front. and pulmonary artery, an artery carrying blood from the right ventricle to the lungs. Case number 8, we have oncology. John Smith, a 26-year-old law student, was admitted to the hospital after experiencing several months of fatigue, low-grade fevers, chest pain, and night sweats. A chest MRI scan revealed large mediastinal masses, as shown by the arrows. Needle biopsy confirmed a diagnosis of Hodgkin lymphoma. There was no evidence of lymphadenopathy or hepatic involvement. Treatment included chemotherapy, followed by radiotherapy to the chest. Mr. Smith's prognosis is good. Our terms, we have chemotherapy, treatment with drugs, most often used in the treatment of cancer. Diagnosis, complete knowledge of a patient's condition. Fatigue, state of exhaustion or loss of strength. Hepatic is pertaining to the liver. Hodgkin lymphoma, malignant tumor of lymph nodes in the chest. Lymphadenopathy, disease of lymph nodes. Mediastinal is pertaining to the mediastinum, which is the space between the lungs. MRI, imaging of the body using magnetic and radio waves. Organs are seen in 3 planes: coronal, sagittal, and transverse. Needle biopsy, removal of living tissue for microscopic examination by inserting a hollow needle through the skin. Prognosis, prediction that forecasts the outcome of treatment. And radiotherapy, treatment of disease with high-energy X-rays or particles such as photons and protons. Next, case 9, we have orthopedics. An 80-year-old female fell over a misstep, causing multiple subtrochanteric fractures of her left femur. Figure 9a shows the location of the complicated fractures. Figure 9b is a side view, lateral cross-table X-ray, showing the displaced broken bone. She was immediately hospitalized, and the next day surgery performed was an open reduction internal fixation, or ORIF. Bone and incarcerated muscle were put back in place. A titanium rod was inserted through the center of the femur and stabilized with screws placed into the head of the femur and near the patella. Figure 9C and D show X-rays of the rod and screws taken 3 months post-ORIF. Note the arrow in part C showing unhealed femoral fracture. Many months of physical therapy will be crucial to her full recovery. Our terms for case 9, we have femur. This is the thigh bone. A fracture is the breaking of a bone. Incarcerated muscle. This is muscle that becomes trapped or compressed in a body structure, restricting movement and potentially cutting off its blood supply. Internal fixation, to stabilize a broken bone with rods, screws, and plates inside the body. Open reduction, surgical procedure used to treat severe fractures or dislocations. Open means that incisions are made through the skin to gain access to bones and muscles. Reduction is a surgical procedure to reposition and connect broken bones. The patella is your kneecap. PT, or physical therapy, treatment that uses exercise, stretching, manual techniques, and other therapies to improve movement, reduce pain, and restore function after injury or illness. Subtrochanteric, located just below the greater and lesser trochanters of the femur, typically referring to the upper part of the femoral shaft. And titanium rod, a strong lightweight metal implant used to stabilize and support broken or weakened bones during healing. And our last one, case 10, is urology. Michelle Jones has a history of lower back pain associated with hematuria and dysuria. An abdominal X-ray film shows a renal calculus in the right kidney. Her doctor explains that renal calculi should be suspected anytime a calcification is seen within the renal outline or along the expected course of the ureter leading towards the bladder. Treatment with shock wave lithotripsy is expected to crush the stone that migrated to the ureter and relieve her signs and symptoms. So our terms, we have dysuria, painful or difficult urination; hematuria, abnormal condition of blood in the urine; lithotripsy, process of crushing a stone in the urinary tract using ultrasonic vibrations; renal calculus or renal calculi or kidney stones; signs and symptoms, objective finding or indications of disease observed by the patient, such as abdominal pain, fatigue, or loss of appetite. And ureter is one of two tubes that lead from the kidney to the urinary bladder.